You probably have an image of what goes on in an emergency department, behind the scenes. But what about the people really pulling the strings, the ones keeping the chaos just about manageable?
Exactly.
Today, we're doing a deep dive into exactly that, the absolutely critical, really demanding role of the nurse in charge, or NIC, in the ED.
Yeah, we're looking at this really fascinating study. It's from Addenbrooke's Hospital, and it focuses on the specific ways these NICs uh, solve problems and how they coordinate, with their teams.
Right.
Our mission really is to give you a bit of a shortcut to understanding this incredibly complex, high-pressure environment. It's about getting a fresh look at how they bring, well, predictability to chaos.
Okay, let's break this down then. The NIC's main job, their core function, it's about making sure everything runs smoothly, right? Coordination across the whole department.
hmm And they often work really closely with the emergency physician in charge, the EPIC.
Ah, the EPIC. So they're a team. But it's this NIC role that's so
Yeah,
demanding and, like you said, maybe not researched as much as you'd think.
that's right. And what's really interesting here is how the study identified these 8 distinct approaches to solving problems. You could think of them as sort of mental shortcuts, go-to strategies.
Okay, heuristics.
Exactly, heuristics, things the NICs use almost instinctively, like placing, targeting, guiding, juggling, chasing,
Hmm.
team leading, escalating, and de-escalating.
Wow. Okay, quite a toolkit. And you mentioned some were specific to the NICs in this study.
Yes, that's a key point.
Yeah.
Team leading, escalating, and de-escalating were found to be, well, pretty much exclusive to the NICs.
So how does that differ from what the EPIC, the physician, might be doing in those areas?
Great question. It really shows the NIC as the operational leader.
Hmm.
So the EPIC is focused on the clinical side, the medical decisions for patients.
Right, the diagnosis, the treatment plan.
Exactly. But the NIC is orchestrating the system. So team leading for an NIC isn't just managing tasks. It's about inspiring the nursing staff, keeping morale up.
Keeping the team cohesive.
Yeah. And escalating for them might be about getting more beds, more staff, fixing operational bottlenecks, not just escalating a patient's medical care.
Okay.
And de-escalating.
Hmm.
Think about a major trauma coming in, or maybe a really difficult psychiatric case. The NIC steps in to calm the whole environment, support the junior nurses, keep the flow going, not just manage that one patient clinically.
That paints a really clear picture. It's less about the medicine itself and more about, well, strategy, deploying people, resources, like a conductor almost.
Precisely, you nailed it.
Can you give us a concrete example, maybe placing or de-escalating an action?
Sure. So placing, that's where the NIC is laser focused on moving patients to free up space and resources.
Hmm.
Like stepping down patients from getting them out of the resuscitation bay to a less critical spot.
Okay, freeing up that high-intensity resource.
Exactly. Or constantly watching ambulance offloading in available space, just always thinking about flow, about capacity. Or de-escalating, like we touched on. Managing those really tough situations, maybe a very agitated patient where junior staff might be struggling. The NIC comes in, brings that calm, experienced presence to stabilize things. Keep everyone else calm, too. It's like being the eye of the storm.
You can really feel the pressure just thinking about it. And this link between the NIC's operational focus and the EPIC's clinical focus, they really need each other, don't they? Like two sides of the same coin.
Absolutely. Both aiming for efficient, safe patient care, just from different angles.
But how do they make that partnership work so smoothly? They're not operating in isolation, right? There's a whole team.
No, definitely not. And that brings us right to the next key piece.
Hmm.
Their effectiveness really hangs on close coordination with everyone.
Okay.
This is where the idea of shared mental models comes in. It's a term meaning the team members kind of think alike. They can anticipate what others will do, even under stress, without having to spell everything out.
Like a sort of team telepathy, a shared brain.
Sort of. It's about creating this shared awareness. And the NICs work hard to maintain that.
How do they do that? How do they keep everyone synced up?
Through really systematic rounds, checking the digital patient trackers, the electronic health record, physically observing all the different areas, lots of verbal communication, using those visual displays
We're
effectively,
constantly gathering and sharing information.
relentlessly.
Yeah.
And the value of that shared understanding is huge. It creates a baseline, a status quo, and that crucial predictability amidst chaos.
Right. Predictability in the ED sounds like gold.
It really is. Allows the team to rely on each other, streamline what they're doing. It's sometimes called cognitive unloading. You don't have to hold everything in your own head because you trust the system and your colleagues know what's going on too.
Makes perfect sense. What about when things go wrong, though? Or priorities clash? Does that happen often?
Surprisingly, the study found that major conflicts over priorities were pretty rare. Yeah.
Yeah.
And when they did happen, they were usually sorted out by what the researchers call an implicit hierarchy,
Goody.
meaning people generally understood who had the final say operationally in that moment, even if it wasn't, formally announced each time.
Yeah.
It just worked. It kept things flowing.
Fascinating. So if you had to boil it all down, what's the key takeaway here?
For me, it's that stability in these incredibly chaotic places isn't an accident. It's actively built.
Right.
It's built through specific, often unseen operational leadership, like these NIC heuristics, and this deep, almost subconscious shared understanding within the team. This deep dive really gives you a window into that vital, invisible teamwork.
Yeah, we've seen how these NICs really conduct the orchestra, using these specific strategies, these mental shortcuts, and how vital that shared picture, that shared awareness is for just keeping things predictable when everything feels unpredictable.
Absolutely. So maybe a final thought for you listening.
Uh,
Think about the environments you navigate every day. Your workplace, maybe your family life, even a volunteer project. Where do you see that predictability amidst chaos?
hmm.
And what systems, what mechanisms, formal or informal, might be creating that stability? What little heuristics, what smart shortcuts are people using around you to keep things moving, even when it feels like it could all fall apart?